My name is Tenley. I'm the OpenLMIS Community Manager, and welcome to the OpenLMIS webinar series, the Vaccine Module Update. We really appreciate your time today. Today's webinar is open to the public and will cover updates on the latest developments of the OpenLMIS Vaccine Module. Can everyone see my screen?
Yes, we can see your screen.
Yes, we can see it.
Okay, great. Thank you. So I will be facilitating today's webinar, and our presenters will be Mary Jo Kokendorfer, who is the OpenLMIS Product Manager, and Rachel Powers, an Associate in the Information Systems Group at Village Reach. So just a few logistics for the webinar today. Please remain on mute throughout the webinar. We're going to have quite a few participants, so please ensure that you remain on mute. We're not going to be asking questions out loud, so please ask questions using the chat function at the bottom of your screen. And this should be fairly easy to do. Just send a question to everyone and we'll address the questions during the Q&A pauses throughout the presentation. So please type in your questions, and if your question is not answered during the presentation, we will be able to follow up with those questions if you send them to info@openlmis.org. So again, please don't ask your questions verbally during the presentation. Please type them into the chat box, and then we'll have Q&A pauses throughout the presentation, at which time the presenters will address your questions. So just a quick recap of our agenda today. We're going to give a very brief introduction to OpenLMIS, a recap of the vaccine module project scope, new developments with the vaccine module. We're going to showcase completed features to date in the vaccine module. We'll give a status on the minimum viable product, or MVP, features for OpenLMIS vaccine module, and then we'll give some quick closing remarks. Also wanted to let folks know that this presentation and the recording will be available on the OpenLMIS wiki as well as the OpenLMIS YouTube channel. So let's go ahead and get started. What is OpenLMIS? OpenLMIS is an open source, cloud-based electronic logistics management information system, and it's purpose-built to manage health commodity supply chains in low resource settings. The OpenLMIS initiative is supported by this community of health implementation and funding partners, and they're committed to the ongoing support and guidance for the OpenLMIS software and community. The OpenLMIS community comprises 3 committees that meet regularly to review global objectives, discuss and set standards for LMIS systems, and to define the product roadmap for the OpenLMIS software. One of these committees, the OpenLMIS Product Committee, meets twice a month to discuss, review, and approve software development and new features for the software. So to quickly recap some of the key features and functionality available in OpenLMIS, requisitions and ordering. So this is the ability to create, authorize, and approve requisitions or orders, both regular and emergency, and to generate orders for external fulfillment from a separate warehouse management information system. OpenLMIS also comprises setup and customization screens, allowing administrators to manage users, permissions, programs, facilities, and orderables through bulk uploads and administrative screens. The system is highly flexible, and it can be configured to match specific processing, reorder periods, policies, and hierarchies. And finally, stock management. This feature allows a user to manage stock at their specific facility, managing electronic stock cards, performing physical inventories and adjustments, and tracking ins and outs of stock. So we're focusing today on the OpenLMIS vaccine module. Where does OpenLMIS currently manage vaccines? So OpenLMIS manages logistics data globally for over 10,000 health facilities across 7 geographies. OpenLMIS specifically manages EPI data in 4 geographies across Africa. And in Mozambique, OpenLMIS manages EPI data for 830 service delivery points, which reach over 13.8 million people. So just the why of why we're building the OpenLMIS vaccine module. Some takeaways from the most recent TechNet 21 conference and also reasons identified by global immunization stakeholders are that without good digitized data and a reliable system to capture, aggregate, and disseminate data, EPI managers can continue to struggle to manage evolving, expanding systems. So OpenLMIS has focused on developing vaccine-specific functionality to help assist EPI managers with the specific considerations they have for their vaccine supply chains. Again, just a quick reminder, please do stay on mute during the presentation. Thank you. So I'm now going to pass the presenting ball to Mary Jo Kokendorfer, our OpenLMIS product manager, who will now discuss the project scope for the vaccine module and further developments. Mary Jo?
Thanks, Tenley. And as Tenley mentioned, with the support of the Gates Foundation and through ongoing work within the immunization information systems across multiple low to middle income countries, the OpenLMIS community saw consistency in these requests coming from EPI programs and their partners regarding the functionality and reporting needs to manage their vaccine logistics and program data. So we decided to work towards building a generalized version of those requests. These requests included common needs across countries for flexible vaccine data collection tools and consolidated views of vaccine service delivery, logistics data, and cold chain inventory management. So based on what we were hearing from our community, we began a community process to establish support for this vaccine module within the new version 3 of OpenLMIS. To gain buy-in from the global stakeholders and funders, we had a kickoff meeting in March. And at that kickoff meeting, we brought in all community stakeholders and talked about what systems we needed to draw requirements from. We looked at VIMS, SIGL, VLMIS, HCMIS, CEL, the DBDMT, SMT, and many other user stories across our community. We also looked at different KPI and reporting needs, sourcing information from Gavi, WHO, and UNISTEF. Then we also did stakeholder input and interviews. So it was a collaborative community process to build upon existing efforts out there. Subsequently, we then came together to prioritize the scope and validate the user needs. After this process was conducted, when we began software development, it's an iterative approach where we meet with the product committee every 2 weeks and discuss upcoming questions and view mockups, and then we iterate over and over again. So this was the overall process that we followed to scope out this vaccine module. Next slide. As I mentioned in the process, we had a prioritization workshop in person, and we had over 27 attendees with representatives from a multitude of community members, from UNICEF and Gates to NextLeaf and PATH. We encourage you to look there's links on these slides, so these slides will be available on our wiki and after this presentation, and you can follow these links, underline links, to see the actual full report if you're interested in the outcomes and discussions we had during any of these meetings. So the prioritization in Copenhagen was to set the scope for the module. Once the scope was set, we began digging into the details, and we identified that the resupply domain was a really complicated domain that we wanted to ensure to have input, design input from our users that would be using the system. So we held an in-person user design prototyping meeting in Senegal. We had 12 attendees from EPI programs in 5 countries, and we really focused in on defining the key workflows and the main data elements that are needed and associated with it, making decisions in resupplying vaccines within the supply chain. And again, you can see here, and when you take a look at this presentation after the fact, you can look at the full report and artifacts or outputs of this meeting. Next slide. So what was the scope of the minimal viable product or the vaccine module? This is a lot of information on one slide, but ideally the main strokes of what we were aiming to achieve fall into 4 domain areas we call. The first one is requisition and allocations, or sometimes we call resupply, which is the either ordering through a requisition or allocating stock through a distribution to lower nodes in the supply chain. And this, as we mentioned, is one of the more complicated domains where we focused on our user design process. In addition, we have features around forecasting and estimation. We wanted to build upon our current stock management features for the specific needs of vaccines, like including the ability to capture the VDM status. Lastly, the major domain is called cold chain equipment, and this is about uploading a cold chain equipment catalog and then also managing the specific inventory items at facilities and the functionality state. We didn't include a domain on reporting because reporting cuts across all of these, but that is another major piece of this module, is being able to support the DISC indicators. And again, our estimated release date is March 30th with the 3.3 release, and you can follow along on this roadmap and get live updates if you go to the link at the bottom of the slide, which is the living product roadmap on our wiki. Since we began this journey, we've had some new developments, additional scope, and new partnerships that we wanted to highlight today. One very exciting opportunity and partnership with ONA, we've decided to invest in creating, with the need to create the DISC, supporting the DISC indicators, and to help OpenLMIS users make better sense of their supply chain data. We developed a modern big data warehouse setup for reporting in OpenLMIS. And this is very exciting because this infrastructure is all based off of open source solutions. There's a lot of information here and it's quite technical. And so I've included a link here to the full detailed spec of this infrastructure at the bottom of this page. But ideally, and the key takeaway here is that we'll be able to ask really in-depth questions of our data and be able to support huge volumes as we move into a transactional and higher volumes of data. And another exciting opportunity is we hope to establish a standardized way for storing data, health data for OpenLMIS, on top of which other common tools and APIs and dashboards for analysis can be built, which means we could also push data into DHIS2 or other systems, or source data from other systems like OpenMRS and DHIS2. So we're very excited about this new data warehouse and reporting infrastructure. And if you're interested in more details, please reach out to us or join our product committee, as we do have discussions about the details of this infrastructure and capabilities. Here are some example reports and dashboards that are out of the box with the Superset application, which is open source, that we're going to be leveraging. It was initially developed by Airbnb and provides an intuitive interface to explore and visualize data sets. We're really excited about this tool and look here for more updates on the DISC indicators getting visualized within this new tool. Another exciting development is that we are working on a reference mobile integration with OpenSRP. For those of you not familiar with OpenSRP, it's an electronic case management system and vaccine registry. This partnership would allow OpenLMIS to extend visibility to the facility level and capture program-related data like children immunized. The plan is that OpenLMIS can send advanced shipment notifications and receive stocking information from the OpenSRP application to create requisitions and support the reorder of new stock. There's quite a lot of scope to be discussed with this integration, and we are thinking to conduct another webinar in January to share details on this scope of work But now we just wanted to share that we are in the initial phases of defining what the scope of work will be, and we're very excited about the potential value add that this can bring to our community.
All right, great. Thanks, Mary Jo. Just wanted to take a quick pause here for Q&A and see if there are any questions that folks have shared in the chat. Rachel, you've been monitoring the chat. Do you have any, have you seen any chat questions come up so far?
I haven't seen any come through, but I think if people have any, we could add them right now, and we can address them quickly before we start in the next section.
Okay, great. So folks, just a quick reminder, if you do have any questions on what we've been talking about so far, please type them into the chat box in the Zoom meeting, and we'll be able to answer those questions. So in the interest of time, we'll go ahead and keep moving through onto a showcase of our recently developed features.
Great. Hi, everyone. This is Rachel Powers, and I will be going through some of the features that we've already built for the OpenLMIS vaccine module. Now, through this work, we've been improving a lot of elements of the current OpenLMIS system, but there are certain features that we're building from scratch specifically as part of our new focus on vaccines. So today I'll be talking a little bit and showing you some features from cold chain equipment and ideal stock amounts. So starting with cold chain equipment, I just wanted to review the scope that we were looking at for what we wanted our, this first version of the cold chain equipment management features to include. From what we heard from our stakeholders at Copenhagen, we realized this needed to be 4 parts. 1, creating and updating a cold chain equipment catalog within the system. 2, creating and updating an inventory list for all of the cold chain equipment devices that are present at each facility. And this includes adding new devices as they are added to an actual facility. 3, we wanted to make sure we could update functionality status for each device and have a way for users to look through the inventories to pinpoint which devices aren't working, which need attention, and how to manage the functionality of the devices within their purview. And 4, this is something that we're still currently working on. The first 3 we've brought to our completion of our first version for cold chain equipment, but number 4 is remote temperature monitoring. And we know that remote temperature monitoring is the direction that a lot of the most robust cold chain equipment systems are moving towards. And so we really found it important to start off doing some integrations with OpenLMIS and RTM systems. So based on some of the work we've done in the past with country implementations, we are working with the NextLeaf team and their program around cold trace to do this sort of first integration. And I know some NextLeaf people are in the call as well. So if you have anything you want to add later on in our Q&A, I welcome you to do that. All right, so I'm just going to go quickly through some of these features that I mentioned. First is uploading cold chain equipment catalog. The way that we have envisioned and sort of executed doing this for the first version of this vaccine module is uploading a catalog using a CSV file. So this is a screenshot from the system as it is right now with what we've built. You can see there's a place to download the current catalog, and then also once the user has updates for that catalog, they can upload that back into the system. The next thing I wanted to show you all was this page that we built for CCE Inventory list. Now, the user profile that we consider most often when we are doing this cold chain equipment work was the District Immunization Vaccine Officer. Now, this person has different titles in every country, but essentially we were focusing our usability on the intermediate level person, the vaccine officer, who will be looking across all of the devices in the facilities within their district and making sure that issues with functionality are tracked, that new devices are added, and that the inventory is kept up to date. So I just wanted to point out that on this page, we have a number of things going on. We can filter by facility. We can add new devices to the facility, and those are adding it from the catalog that we just looked at in the previous slide. We also have these little icons that allow us to jump to updating functional status of each device. And then we can also view device details for each of the actual CCE devices that are present at the facility. So this is just a GIF that I've put together to kind of show how someone might go into the CCE management module, do some initial filtering, and I think we have another one on the next slide. Tenley, if you would go to the next slide. This is how we add new equipment to a facility. So choosing the program, the facility, equipment type, and then on the next slide is showing the information that we would actually add for each of those devices. I know this is going a little fast. It does repeat, and there's only a certain length for the different for the GIFs that we can include. But if you're interested in a more sort of in-depth look at these systems, we do allow people to schedule demos of the system and sort of have a more sort of in-depth walkthrough of that. All right, so I just wanted to revisit this page one more time and talk about the updating functional status icon. So that's the view and update functional status. So if we were to click on that button, we'd get what we call a modal that pops up, and you can actually quickly update the functional status for each device. Now this includes changing functionality status, adding a reason, and it also keeps track of who it is, which user it is that is making these updates. All right, now for ideal stock amounts. For those of you who are not familiar with ideal stock amounts, these are based on WHO population formula elements that are completed at a national forecasting level for countries to understand sort of what the ideal amount of stock is for each facility throughout the period of a year. And this was a big ask from folks at the Copenhagen workshop that we make sure we include some functionality around ICEs, as we call them. The way that we are approaching this for our current system is, again, we are allowing people to upload ideal stock amounts as a CSV file, download what's currently in the system to view what the system is basing sort of any metrics on. And then in the future iterations, we will, Mary Jo will talk a little bit about how we're also going to be including ICEs in other elements of our features. So again, this is just a short GIF to show how we get to that page. All right, so I'll pause now. I see that there's at least one question in the chat, so take a moment to add any questions or comments that you have around this showcase. And I'll start with Matt's question. So Matt asked, is there a template or standard format of the CCE upload data? So I think, is that, Matt, I think you might be asking about the catalog data. If that's what you're asking about, okay, he said yes. We have set a template CSV file that includes certain column headings that a user will have to include to make sure that their catalog devices are uploaded to the system accurately. And these were all based on work that a number of organizations have done around sort of what data elements are critical for tracking and managing cold chain equipment devices. Ideally, what we would like to see happen, and the members of the OpenLMIS team have engaged in some of the community work around PQS catalog sort of refurbishment, is we would love to see the WHO put out an Excel or spreadsheet version of the PQS database that they keep updated, so that countries can use the PQS database as the starting point for their catalog, add on their own devices as needed, but have most of the information that they need available from those standards that WHO puts out. All right. So Ben just asked a question. Excuse me. Is the ISA CSV file that the users can upload comprised of values, numbers, or formulas? I'm going to punt this to Mary Jo because I think she has a better sense of how to answer this question.
Their values, Ben, the answer is their values. So the current iteration in the Copenhagen workshop, there are a lot of features that are desired by the community around forecasting and estimation. One would be support doing the annual forecasting process and actually populating the WHO formula itself within the system. However, the decision was to take an iterative approach, and our first step is just allowing, after the country has done their annual planning outside of OpenLMIS, to be able to upload the result, so the end values of those ideal stock amounts. In the future, we could look to build out additional functionality here and have actually discussed sort of putting proposals together around that to look to improve that functionality and do more within OpenLMIS. But at the moment, we were looking at the minimal viable product, which is getting those values in there to inform reorder amounts. Resupply decisions was our first cut. So great question. All right.
Okay, great. So thank you, Rachel and Mary Jo. So we're going to continue our presentation and talk a little bit about the status of the MVP for the vaccine module.
Great. So we've already given you some information about an update. Rachel shared with you the features that are already implemented in the system around cold chain equipment and ISAs. You can move to the next slide. We got another question, and it's, I think I want to you want to go back a slide, Tenley, before I get into this. Will there be a capacity volume against each cold chain equipment and used for inventory analysis and cold chain equipment was the question. Rachel, at this time, you can put the volume in, is that correct? Or did we wait?
Yeah, so for each cold chain equipment device, there is an option to include the capacity in the cold chain equipment catalog, so that can be tracked for each device that you add of that device make and model and type. We do have plans sort of down the line. It's not part of our minimum viable product to use that information for inventory analysis, but we have those features identified where we would want to use both the capacity of a device plus the amount of stock at that facility to analyze exactly how much capacity is available in the cold chain equipment of a facility for receiving vaccines. The piece that this also relies on is real-time stock data. So that is kind of what we would need to make sure we have from facilities before we can provide reliable information on what, exactly how much space is available for new vaccines to come in. That's a great question, though. Thanks.
Absolutely. All right. So to give context of the slide, the 100 on the right is a % complete, but unfortunately does not provide an accurate scale in terms of level of effort. It's a complicated process to first define the scope of the features and then the level of effort to achieve that. And so this is only around 1% complete in terms of what features we said that we would have, not the level of effort it takes to achieve those features. For example, specifically around forecasting, we only have a couple additional features that we identified for the minimal viable product. For example, displaying the ISAs or the ideal stock amounts within the allocation process, or using that ISA to calculate the reorder amount within a requisition or within the allocation, which won't be a challenging feature to implement because we already did the kind of big chunk of work, which is to get it into the system. So I did want to call that out, that some of these might look like not much has been done for forecasting specifically, but we still need to work on the requisition and allocations piece before we can display that information. So there's a lot of interdependencies between these domains of being able to display information. And then the last piece of the, I'm going to go through each domain in more detail for a second. So the first category of resupply, which is fulfilling orders, making an order, and allocating, we're really focusing on that right now and getting started. And that's going to be the largest piece of effort for the remaining months before the end of March. Stock management and cold chain equipment, you see, are pretty well completed. Stock management, we have a bit left in terms of some additional validations, but again, they're not big pieces of work. And then the cold chain equipment piece, the last remaining thing is the integration with Nextleaf for the remote temperature monitoring. And so that would be flagging and hitting the functionality status of those cold chain inventories. And then lastly, with the reporting, we have almost completed the infrastructure setup, and then we'll incrementally work on the disk indicators. So the level of effort to make those disk indicators shouldn't be as large as doing the infrastructure piece. So hopefully over time, we'll be able to see big improvements here. Going into depth on the resupply, since that is the largest chunk of work to be done, we are breaking it apart a little bit, and I want to give some background of what we mean by resupply and why this is really exciting work for us in OpenL.MIS. The left-hand diagram here you'll see is what's currently within OpenL.MIS already. And our resupply process is where within OpenL.MIS a requisition is created, and then improved and converted to an order and sent for external fulfillment at a national ERP. What we're looking to do and build out within OpenL.MIS is doing a local fulfillment, which means creating orders and approving and then fulfilling those orders and resupplying the facility. And so this is really exciting and very complex because, as one knows, supply chains can be mixed. So different geographic areas can be doing requisition-based, others could be distribution-based. And so it's a pretty complicated feature set to build out. And we're really excited to get into the details here. And if folks do have questions about this, please feel free to put this in the box in the question chat. And so a little more detailed breaking out resupply, so hopefully clarify what we mean again here is OpenL.MIS will be able to support multiple ways of creating an order. So either having it based off the requisition, which it currently does, and we are looking to build out a requisition light, meaning if you do a physical inventory, it'll automatically generate your order. Also allocation-based orders, where the OpenL.MIS user is entering the information in about the facility and planning a distribution. It also supports the emergency orders And another feature within this will be using the reorder, calculated reorder will be based on ISA or consumption based on what the country desires. And having the reorder on ISA is a new feature within OpenLMIS. In fulfilling an order, this is an exciting area because we will be able to do this within OpenLMIS, so you can see the order quantities, you can see your stock on hand as the fulfiller and confirm and set those fill quantities, and then lastly, ship and populate a proof of order for confirmation of those deliveries. Here's the example mockup that we've been sharing with the product committee and community around what it will look like to fulfill an order. So the second step is once the order is created, taking a look at that and being able to see the needed data elements and set your fill quantities. Next, we wanted to give a little demonstration and overview of stock management. So if you go to the next slide. Earlier, what you can do, we mentioned you can do a physical inventory or stock take. You can do an issue, you can record or receive, or do an adjustment. And what we have built out and modified here is that, this is this example of viewing a stock on hand. So you can see with each product what the current stock level is, and you can press the view button to get to the details and see all the historical stock transactions. The next one. This GIF is showing you how to do a physical inventory, and you can enter in the current stock on hand levels. This GIF is not showing us, but it is currently available as putting in the VVM status. We just ended up doing a family planning for this GIF, but you can, when doing a physical inventory or a stock take, you can record the VVM status. And if you do not fill in the reasons, it will say it's invalid. So this is demonstrating the validation process of if you don't fill in the reason for the adjustment, the system will say it's invalid and please fill out that, complete your physical inventory. So within all of our features, we do have error handling and validations to ensure good data quality of information.
Okay, great. Thanks, Mary Jo. Really exciting features that we're working on here. So let's take a look and see if there are some questions in the chat box. So yeah, we have a couple questions here from Teresa. I've heard that there are some restrictions with pushing remote temperature data. Will this be an issue for the cold chain module? And so Rachel, you chatted a little bit. Teresa, can you say a little bit more of which restrictions? There's some feedback from Afghanistan and Pakistan regarding electronic systems and discussions with suppliers. The feedback they've gotten is because their system isn't PQS certified, the temperature data can't be pushed to their system due to potential security risk. Mary Jo, do you have any thoughts on this?
I'd also like to, I personally have not heard of this concern. Maybe Martin, have you heard of this type of concern before? I believe Martin's on the call as well. Sorry to call you out as this is our webinar, or is he no longer on the?
I think Shahrzad is also on. I'm not sure if either of them would be able to speak to this. It's certainly interesting to hear about, and I think it's important for us to think about, for exactly what you said, Teresa, for things that aren't PQS certified,
Hi,
how do we
this
ensure
is
that people are getting it?
Can you guys hear me?
Yeah, I'm sorry. Could you say your name again?
Yes, this is Shahrzad from NextLeaf. I believe Martin is also online, but I'll go ahead and jump in and Martin can also add. So thank you for your question, Teresa. I think, can I ask a little bit more about this question? What system isn't PQS certified? I don't quite understand the question here.
Teresa, are you able to unmute and clarify a little bit on your question?
Hi, can you guys hear me?
Yeah, we can hear you. Go ahead.
Okay, so Afghanistan is right now trying to build a real-time vaccine stock and temperature monitoring system, and I understand that they're having some issues with the temperature monitoring supplier because since the system is a custom-built system, it's not PQS certified, at least not now. So there's some security concerns from the supplier to push their data into the system directly. They would prefer to have users log in to the website and pull the data, or at least monitor the data through this sort of single sign-on or remote login. I don't know that much about it myself. It was just something that I've heard, and I was wondering if there's any feedback that you have.
I see. So it seems like Martin's mic wasn't working, but it's working now. So he's going to jump in and speak about this.
Can you guys hear me? Hello?
Yeah, we can hear you, Martin. Would you introduce yourself and let us know who you're with?
Hi, I'm Martin Mukac. I'm CTO of NextLeaf Analytics. I'm not aware of, this is actually the first time I've heard someone describe that pushing data from a PQS qualified, RTM system to another system would be sort of a security issue. What we're trying to do here with OpenLMIS is to sort of progressively build towards a sort of integrated system, meeting the sort of MVP along the way. And so if you're interested in this, we can send you along the links on the wiki that track the progress and sort of what are the initial ideas for integration. So yeah, we've not heard it expressed this way where someone is concerned about the security. It would be interesting to maybe take that conversation offline to understand a little better.
Yeah, I think that it would be useful to follow up with you, Teresa, afterwards to make sure we're understanding kind of where the concern is coming from to ensure that we appropriately assess and think about that concern. So,
and sorry, just one clarifying question. Teresa, are you referring to the cold trace system, or is this another remote temperature monitoring system that is not PQS qualified?
I'm sorry, can you elaborate?
Oh, sure, no problem. So this is another RTM system that has been piloted in Afghanistan and Pakistan that is not yet PQS qualified. Is that right?
Correct. I'm not as familiar with the system in Pakistan, but in Afghanistan it is a custom-built system. So it's something that they are developing now.
I see, that makes sense. Yes, and just to add to Mary Jo's comment and also Martin's comment, right now we're hoping to work with OpenLMIS in a way that any progress that we make on the cold chain side and on the RTM side could be used for any RTM system out there. So we're keeping it very, very generic, very open to all the other RTM systems. And I know that usually RTM systems are scaled and adopted in countries when they are PQS qualified. But I think the hardware and software is usually sort of, they have different standards. But me and Martin are happy to talk to you as well if we can be helpful.
and I think Caleb notes some important pieces in the chat as well. And I wanted to call out, maybe there's a desire to have a separate webinar specifically on the integration so that we're defining where exactly OpenLMIS is integrating with NextLeaf. So we're not replicating the functionality that NextLeaf and ColdTrace is doing, but rather integrating and allowing ColdTrace or the NextLeaf platform to alert OpenLMIS when a piece of inventory is fitting a certain parameters around being out of a scope. So we're setting that information within NextLeaf and then alerting OpenLMIS. So OpenLMIS is actually not going to ever be PQS certified because it's not going to serve that function. And so I think this is a good indication that maybe we should have a separate webinar specifically around this integration and sharing kind of our approach and what we plan to do, because maybe that would be helpful for the community.
Great, thanks everyone. So we do have a few extra minutes here at the end. I just wanted to revisit our agenda. And I think there actually may be quite a few folks on the phone who called in and maybe did not join the Zoom webinar itself, and so may not be able to ask questions via chat. So I did just want to open this up and ask if there's anyone on the phone who would like to ask any questions, just to revisit our agenda. We talked today about a quick recap of the project scope for the OpenLMIS vaccine module. We talked a little bit about some of our new developments, such as an integration with a mobile health platform, OpenSRP, and looking at OpenLMIS's data warehousing strategy. And we did mention that we will very likely be pulling that out into a separate webinar because there are quite a few very exciting developments to talk about with OpenLMIS moving forward. We did a quick showcase of the completed features in the vaccine module, specifically looking at the cold chain equipment features and the ISAs, or the ideal stock amounts. And we also went through the status of the minimum viable product, or MVP features, giving an update and then digging a little bit more into the resupply functionality as well as stock management. So I did just want to open it up and ask if there were any questions from folks on the phone about anything that we've talked about today. Okay, so sounds like we don't have any questions right now on the phone. I understand that we presented quite a lot of information today. So just a quick reminder that this presentation, along with all the links and information in it, will be posted and publicly available on the OpenLMIS Wiki. A recording of this webinar will also be made available on the OpenLMIS YouTube channel. So if you just visit YouTube and type in OpenLMIS, there's a whole series of great videos on there demonstrating the stock management and requisitions functionality in a variety of languages, Portuguese, French, and English. And we also have a number of other videos and webinars available. So please keep an eye on the OpenLMIS YouTube channel for additional webinars. We'll continue to host these because they're great ways to explain the current developments and activities within the OpenLMIS community. So keep an eye on that. Keep an eye on the OpenLMIS Wiki as well for this documentation. I'll be sharing updates via Twitter and on openlmis.org as well. So keep an eye out for ways to connect with OpenLMIS and visit our documentation. So yeah, was there a question?
I think you may have heard me unmuting. This is Mary Jo. I did want to give a plug that next week is the Global Digital Health Forum, and OpenLMIS will be on a couple different panels and leading an integration lab with BAO Systems and ONA that supports OpenSRP and doing an integration between the three systems. So if you're going to attend the Global Digital Health Forum, we encourage you to join any of our sessions there. We have multiple on integration and also about what it is to manage an open source community. So check out our website, our wiki, with the details on the different sessions that we'll be attending.
Great, thanks Mary Jo. And so in our last couple minutes here, for those of you who are in the Zoom webinar, I wanted to just open up a quick poll. There's just 3 quick questions here. So I'm going to go ahead and launch this poll. Please just look on your screen and complete voting in this poll if you can. This will give us an idea of whether this webinar was useful, how likely you may be to recommend or use the OpenLMIS vaccine module, And then also whether this is your first time participating in an event or a conversation with the OpenLMIS community. So can folks see the poll that popped up on their screens?
Yes, it came up for me. Hopefully it does for others.
Okay, great. So if you could go ahead and vote, you should be able to select different options. Not sure if this is working for folks. I'm not seeing any votes come through.
I just completed mine. So
Okay. We'll give it just a couple more minutes. Okay, great. Nurin, thank you very much. Okay. Give folks just one more minute here. Okay, excellent. Looks like it's working. Okay, so I'm going to end the poll here. Okay, I'm not sure if the poll results worked. This is the first time we're using it in Zoom, but sounds like some folks were able to share their responses. And as Mary Jo noted in our chat box, if you do have other suggestions for different webinar topics, feel free to chat those here in the chat box or share them with info@openlmis.org. You can also reach out to Mary Jo or myself individually, and we'd be happy to answer any questions about OpenLMIS in general, the vaccine module, our webinar series, and the current developments in the software. So feel free to stay in the meeting and add any additional suggestions or questions to the chat box. But for now, I'm going to end our recording. I just wanted to say thank you very much, everyone who registered and attended the meeting today. And we look forward to seeing you at the Global Digital Health Forum next week. If you are attending, safe travels. And if not, we look forward to seeing you at our next OpenLMIS webinar. So again, this was Tenley Snow. I'm the OpenLMIS Community Manager. Our presenters today were Mary Jo Kokendorfer, our OpenLMIS Product Manager, and Rachel Powers, an Associate with the Information Systems Group at Village Reach. We really appreciate your time today, and we look forward to seeing you soon. Thanks so much.